Kwazwai Zuluganda bamthakazo omuhle muri eZimbabwe lingali tshona njani mthakazo omuhle Zimbabwe omuhle. If you tuned in right now, you tuned into Live Talk, the Connection Studio 7's very own youth program that targets tackling anything and everything youth related. Muri eZimbabwe mthakazo omuhle. I'm your host Mike Hove. Once again, wonke umuntu ongenayo kuhlelo munhu wese ari kupinda muchirongwa chinomugamuchira muchirongwa chedu cheve chidiki chirongwa The Connection. Muineni Mike Hove. We're coming to you from my apartment in Washington, D.C. on Tuesday, the 9th of November, 2021. Muri eZimbabwe, I'm your host, Mike Hove. Nasi mchirongwa chedu cheve chidiki namhlanje kuhlelo lwethu labasakhulayo siqhubekela phambili sikhangela okwenzakalayo elizweni okumayelana ngokumemetheka kwe-coronavirus mberi tichitarisa nyaya yekuparara kwedenda re-coronavirus. Tonight on The Connection, we focus on youth-led programs that are helping Zimbabwe better fight the COVID-19 pandemic. We're going to be joined by several young people, amongst them is Babu Sinyoni, who is the founder of Sila Health. We're also going to be joined by Dr. Tinotendas Memeza, a friend of the show. He is the president of Vaccine Global. And of course, we're going to be highlighting other programs. Now, unfortunately, Muri Zimbabwe, tonight's program is pre-recorded. I'm sure a lot of you can see what's in Amshanja. It's called live. Facebook, live. So unfortunately, you're going to be unable to call in live to give your contributions. However, we're still streaming this conversation on our 3 Facebook pages, that being VOA Ndebele, VOA Studio 7, and of course, VOA Shona Solinga Koshi Zuluganda Bawuti Lako Palaimi Bonenu, Yurai Maundrenu, Pama Pejedu, Pa Facebook, Pa VOA Shona, VOA Ndebele, Pamuchetene, Pa VOA Studio 7. You can also, for our YouTube fanatics, we're broadcasting live on our YouTube page. VOA Zimbabwe is the official page. And of course, for those who are used to streaming our program on our websites, we're live as we speak on voazimbabwe.com, voashona.com, and of course, voandebele.com. So linga koshi Zuluganda ba mthakazo muhle Zimbabwe muhle muri eZimbabwe msakangano kutinya phaye phakanzi share kuitira kuchione chirongwa chedu neuwandu wedu ukuze sibukele phela uhlelo lwethu ngobunengi bethu. Don't forget to press the share button so that we watch the program in our numbers. And of course, linga khohle ukufitizela lapha ukubhala ukuthi like, to press the like button ukuze sibone ukuthi ngempela mthakazo muhle Zimbabwe muhle sisonke like so tirithose phano pachirongwa chedu cheve chidiki. Also feel free to write your comments in the comment section so that we see your feedback on tonight's program. Now, without wasting time with Zimbabwe, let us delve into it as usual. First up, an update on COVID-19. Let us head over to the most recent information released by the Ministry of Health and Childcare. Now, recently, the Ministry of Health and Childcare released a statement on COVID-19 that reads, "The COVID-19 pandemic is raging worldwide and Zimbabwe is not spared. To date, the country has over 132,926 cases and 4,675 people have succumbed to the disease. In the absence of effective medical and health interventions, whilst adopting the physical distancing and masking, herd immunity remains the unmet need for the Zimbabwean population. The government is still accelerating the implementation of national vaccination program. The program has reached a national coverage of 38% of the targeted population as at the 31st of October 2021. Now, that's one of the statements. Globally and nationally, public health discussions have been ongoing regarding extending vaccination to children and other special groups, such as pregnant and breastfeeding mothers. Based on the available scientific data in line with the Medicines Control Authority of Zimbabwe guidance, the specialist pediatricians have recommended that the vaccination of the 16 to the 17 years age group with the Sinovac vaccine be possible. The protocol of the younger age groups is still under consideration." Now, Muri Zimbabwe, this is some of the information. Now, the ministry further states that it wishes to advise the public that COVID-19 vaccination to the 16 and 17 years age group has been approved. All the provinces, secondary schools, colleges, universities, and vaccination centers are hereby required to commence the vaccination campaign of this age group with immediate effect. For the avoidance of doubt, the only vaccine type eligible for this age group is the Sinovac vaccine. So that is the most recent information released by the Ministry of Health and Childcare regarding what they're going to be doing with the COVID-19 program, regarding how they're going to be managing the program, and of course regarding how Zimbabwe plans on reaching its 10 million vaccinated herd immunity goal. Now, without wasting time with Zimbabwe, let us head over to another program that was recently released by the Ministry of Health and Childcare that focuses and explains more in terms of how Zimbabwe is going to be reaching this 10 million herd immunity goal. Let's take a look at a clip that we have courtesy of the Ministry of Health and Childcare's Twitter page.
Zimbabwe aims to achieve 60% herd immunity from COVID-19 with the vaccination of 10 million people by the end of the year 2021. The global goal of fully vaccinating 10% of every country's population by the 30th of September 2021 was set in May by the World Health Assembly, and almost 90% of the high-income countries have met this target. 9 African countries, including Zimbabwe, South Africa, Morocco, and Tunisia, had reached the 10% goal at the beginning of September 2021. You may be wondering, what is herd immunity? Herd immunity occurs when a large portion of a population becomes immune to a disease, making the spread of the disease from person to person less. As a result, the entire population becomes protected, not just those who are immune. We know that COVID-19 spreads through close contact, making crowded areas potentially deadly. But when some members of the crowd have immunity, that changes. COVID-19 vaccines train our immune system to resist the COVID-19 virus and reduce the chances of it spreading. As more people gain immunity by vaccination, the number of infected people diminishes. When enough people have been vaccinated, it is easier for the government to open up all aspects of the economy. Stopping the spread of COVID-19 requires us as a nation to use all the tools available. Protect yourself and others. Vaccines are available at your nearest health facility. So, let's roll up our sleeves and get vaccinated today. Remember, no one is safe until everyone is safe. This message has been brought to you by the Ministry of Health and Childcare Zimbabwe, with generous support from Chicken Inn, Revive, and Baker's Inn.
Well, Zulukandabale asibonela ngempela okwenzakalayo elizweni, na uhulumeni uyasho ngempela ichasisa okuningi ukuthi bazafika kanjani ku-herd immunity lapho elizweni over 10 million besihlatshwe ijekiseni elivikela ukumemetheka kwe-coronavirus. Elizweni sikhuluma nje, there's several different vaccinations that are there elizweni. Ngeviki edlule abakhiphe umbiko besisho ukuthi hayi ngempela abantwana 16 abafika ku-17 sebenelisa labo ukuhlatshwa leli jekiseni elivikela i-coronavirus, i-Sinovac. Uhulumeni ushilo ngempela ukuthi bazasebenzisa izikolo ezitshiyeneyo, amakholiji atshiyeneyo, kanye nezinye inhlelo ezikhona elizweni ezihlaba abantu ijekiseni leli, ezithuthukisa uhlelo lukahulumende lokuhlaba abantu leli jekiseni. Saka muri eZimbabwe muri kuzvinzwira kamega zviri kuitwa nehurumende patinotarisa nyaya dzezvirongwa zviripo pari zvino zvakanangana nekubaya vanhu nhomba inodzivirira kuparara kwe-COVID-19. So that was an update on the vaccination program courtesy of the Ministry of Health and Childcare. But now, to delve into tonight's discussion with Zimbabwe, earlier on I mentioned ukuthi namhlanje kuhlelo we're going to be focusing on the works of Zimbabwean youth in terms of the programs that they are running that target, of course, helping Zimbabwe better fight the COVID-19 pandemic. As mentioned earlier on, namhlanje kuhlelo we're going to be joined by Ubabu Sinyoni, sikhuluma njalo lo Dr. Tinotenda Simemeza. So first up, I had a conversation with the founder of Sila Health, Babu Sinyoni. Now, Sila Health is a tech company that focuses on healthcare. Now, this company that we're specifically focusing on for now, Sila Health, has helped thousands of Africans across the continent better access quality healthcare. This is, of course, Zimbabwe included. So without wasting time with Zimbabwe, let us head over to my conversation that I had with Ubabu Sinyoni, Babusi was able to join us via telephone. Let's hear ukuthi yena ubethini njalo uzasitshela okunengi ngale nkampani yakhe.
We have plans that start from $9.99 per month, right? If you know how much medical aid costs in Zimbabwe, you know that what we're achieving on behalf of our customers is almost unreal. And this $9.99 per month, it's less than the cost of a Netflix subscription. So if you're living in the diaspora and you're contemplating getting care for your relatives, I can tell you confidently right now that we have customers on our platform who are paying $9.99 per month, who are getting free prescription delivery every single month for their parents, and who have that peace of mind as well. If they do get to a point where mama needs to see a doctor or needs access to a dentist, they don't need to rush now to send money to these money transfer services that have their high fees. And Lakofuti, we also have AMA caregivers that visit your relatives at home. So it's something that I didn't touch on earlier, but you won't even have to worry about Utumzale Wako will now have to start getting transportation to get into a town because she's going to climb stairs and over the elevators don't work. Our doctors do home visits, our nurses do home visits every single month. They give instructions on medication, and all this starting from $9.99 per month.
All right, Babusi, thank you again for taking time out to be with us on the show. Let's focus a little more on the Health Pass that you guys have running, the Health Pass program. What exactly does this program entail?
So this one provides you the most basic care. It's basically the most affordable safety net. And what that means is that, you pay that $9.99 per month, and there's a fixed number of doctor and dentist consultations per year that your dependent is eligible for. I'll just have to check on the dentist perks, but I think we also definitely do have home visits as part of this $9.99 plan. And of course, the benefits start to increase as you go to our most affordable plan, which is the $99.99 plan, which is the VIP plan. But in between that, we have smart devices to monitor, your health, to check, for example, diabetes and hypertension at home, of which the nurse will visit you and give clear instructions on how these devices are meant to be used to collect proper readings. And we also have, for VIP customers, a concierge service that includes, amongst other things, a driver coming to pick you up to take you to your appointments, as well as feeding you in town should you need to take medication you need to take food before taking medication, for example, and other things that include ambulance cover. And very soon we'll also introduce an underwritten hospital plan that will be an accompaniment to all of the plans that we offer.
All right, Babusi, thank you so much for that. Let me hold you on the line there. There's a video that I'd like to play of the Bulawayo City Council Communications Director, Unesi Samboko, where she focuses a little more on the partnership that Sila Health has with the Bulawayo City Council. Now here, of course, she's focusing on the COVID-19 program that you guys are running alongside the City Council. So let's head over to that video, and when we come back, you get to tell us a little more.
As a city, just like the rest of the world, we are faced with the COVID-19 pandemic, which firstly is a global pandemic, but secondly places a very large demand on information. It is our mandate to ensure that our community has access to accurate information about COVID-19, but are also able to get this at the comfort of their home. We know that Bulawayo, like the rest of the world, is now technologically based. And to this end, we've been working with Sila Health, which is an African healthcare startup company, which was started by someone from Bulawayo who is based overseas. And through this partnership, we've come up with an app. The application is an information application that is targeting our community. It allows us to engage via chat platforms, and it looks at, firstly, what is COVID-19? It gives us a breakdown of what the disease is. Then it also tells you what to do, who to contact to get assisted.
Right, well, as Lugandaba alisanda ukubukela ivideo eka nkosikazi uNesisa Mpofu, she is the communications director phansi kweBulawayo City Council muri Zimbabwe. Tinotenda zvikuru munhu wese ari nesu pano pachirongwa chedu chevechidiki. Mabva kuona video ka ya Nesisa Mpofu, ndiwo ka informations director pasi peBulawayo City Council, vari kutaura ka zvizere nezvechirongwa chavainacho apo vari kudyidzana nekambani yesila health. Pachirongwa tina Babusi Nyoni ndiwo ka mutungamiriri wekambani yesila health, chinangwa chiri chekubatsira zvizvarwa zveZimbabwe pamwe chete nezvimwewo zvizvarwa zvedzimwewo nyika dziri muAfrica munyaya dzeutano. Now, Babusi, tell us a little more about the partnership program that you have as Sila Health with the Bulawayo City Council.
Okay, great. Thank you very much, Mike. So just to give you some background as to when we began this partnership, this started out during a time when the city of Bulawayo was crippled in its ability to test for COVID-19 at a time when the virus was starting to take a grip. And we stepped in and offered our services to disseminate critical information at scale and measure the impact of the city's response, and also, of course, reduce the spread of COVID-19 by deploying our chatbot that offered COVID-19 symptom assessments in the languages available in Zimbabwe, and providing this data to the city of Bulawayo, as well as allowing people who were identified as potentially positive to know exactly which departments to call or which institutions to visit should they require actual testing and contact tracing. Mm-hmm. And we did this and the key results from this effort within such a short period were, close to 600% improvement in patient outreach, as well as a 15% reduction in call center queries, which meant that we were handling a lot of the burden that would have fallen on the City of Bulawayo's health department through means that we had developed as a company since 2019. Mm-hmm. And this was a case study that, we were able to employ in other places around the world. And I'll, take this opportunity again to applaud the City of Bulawayo for being so progressive during such a critical time and, sparing no expense in ensuring that the lives of the citizens of Bulawayo would be, taken well care of and, not compromised by lack of access to resources, as was initially the case around the world, especially in the global south when COVID first came to African shores.
Now, Babusi says, we're now reaching an end of our conversation here. As we wrap up, I want to focus a little more on the work that Sila Health is doing alongside or in partnership with Zimbabwe's Ministry of Health and Childcare. And of course, not just the Zimbabwe's ministry, because you mentioned that you guys work across the whole continent. So tell us a little more about the partnership that you guys will start off with Zimbabwe and then, of course, expand onto other governments that you're working with.
Yeah, so we typically don't really work with ministries of health, but we partner with municipal level healthcare departments and initiatives at that level. We also work with non-governmental organizations. So we have various partnerships with some youth-led organizations, as well as, long existing health-focused organizations that have a footprint in Africa to offer our technology to help them increase their capacity and widen the reach of their initiatives. And most recently, we came on board with an initiative between the Africa Union, the Africa Center for Disease Control, as well as the MasterCard Foundation to deploy $1.3 billion with the Africa CDC to save lives and livelihoods through a COVID vaccination program that will be carried out over the next 3 years across Africa. So what we're doing is thinking, beyond structures that can often limit innovation and looking to create partnerships with, for example, Nesisa Mpofu, who, as I said before, is really forward thinking, and as we've realized recently, the Africa CDC as well, creating these partnerships to really accelerate access to healthcare in Africa, making sure that the tech that, has been built in Africa for Africa can be used for the very people that it is meant to serve. And, going forward, we see more partnerships like this one with the Africa CDC, as well as with more non-governmental organizations that have wider footprints across the continent, being more the norm in our efforts to increase access to healthcare in sub-Saharan Africa.
Well, Babusi, thank you so much there for taking time out to be with us. In closing, could you tell people more in terms of where they can find these services of Sila Health? And of course, most importantly, why you think it is so valuable, so important for them to subscribe to your services?
Yes. So if you are a Zimbabwean living in the diaspora, you most probably have loved ones back home, and I would really encourage you to reach out to us via our Facebook page, that is Sila Health, or find us on our website, which is www.sila.health, and send us a message through our contact form, or send us an inbox message, or write on our wall on Facebook, and just find out what we can do for you. We're here to serve as abameli, basically, for people living in the diaspora, to ensure that the best quality of care can be procured for their relatives back home. And if you are living in Zimbabwe and you have limited access to private healthcare and also, limited spending power, we also do have our chat-based platform, which is the SysJoyce chatbot, which is accessible via WhatsApp. I think you can find a link to that on our website as well, or you could also search for SysJoyce on Facebook, and this will give you instant answers to any questions that you might have about your own health. These include questions around sexual health, for example, that you might feel nervous to speak to a family member about, or might not think it's worth going to a clinic over, but these are things that we handle every single day privately. It'll be your dedicated healthcare assistant, and this is something that is being used by over 60,000 people around the world at present. We have plans that...
All right, then, Maria Zimbabwe, you just heard from Ubabusi Nyoni there. He is the founder of Sila Health. Besixoxa laye besilaye kuhlelo sixoxa ecingweni. Maria Zimbabwe mabva kunzwa hurukuro yadakaita naBabusi Nyoni, ndiye kamukuru wekambani yeSila Health, avo vari kubatsira vagari kana kuti vanhu vanobva kunyika dzakasiyana-siyana muAfrica, vachibatsira zvekare dhorobha reBulawayo mukurwisana nedenda recoronavirus. Manzwa hurukuro yataita naVanyoni, mukanzwa zvekare information director veBulawayo City Council Muzvare neSampofu nawo vachitsanangura zvizere nezvechirongwa chavainacho apo vari kushanda pamwe chete nekambani yeSila Health. Kambani yavo iri kushanda nemazvo mhuri yeZimbabwe mukubatsira vanhu vanogara munyika dzakasiyana-siyana muAfrica kuti vawane mushonga kana kuti mishonga pamwe nekurapwa zviri nyore, iyo yatinoti nechirungu easy access to quality healthcare. Kazhinji tinonzwa vanhu vachichema-chema nenyaya idzi dzeutano, asi chionaiwo pane kambani iri kutungamirwa newechidiki wekuZimbabwe, chizvarwa chekuZimbabwe, vaBabusi Nyoni, vari kuti hanzi for $9 per month munokwanisa kuwanawo rubatsiro rwamuri kutsvaga munyaya dzeutano. For those tuning in right now, thank you so much for joining us. Muri Zimbabwe, you're tuned into Livetalk. The connection, unfortunately, in our quarterly. Remember, this is a pre-recorded program, so you can't join us live. However, for those that are looking to give us their feedback, or of course, which was still available on our three Facebook pages, those being VOA Ndebele, VOA Shona, and of course, VOA Studio 7, Skonanjalo, YouTube, as we speak, our official page is VOA Zimbabwe. So don't forget, Muri Zimbabwe, when you write my comments, share the program, and of course, share your comments so that we can receive your feedback. Muri Zimbabwe, varikupinda muchirongwa tinotenda zvikurusa pari zvino makateerera chirongwa chedu cheve chidiki wohlelo The Connection nelami uMike Hove.
Kudarika ezai kusaungana ezai kusaenda paruzinji nekuti COVID-19 chirwere chiriko. Garai muchisanitiza, gara une kako kasanitiza nekuti kaneuraya virus. Chinza masymptoms evirus, kugodzera isymptom, kupisa muviri isymptom, kutadza kupema zvakanaka hapana chakanaka pa masymptoms. Kana uchida rubatsiro fona pa2019, rubatsiro runouya pauri, asi ngatizvichengetedze.
Shout out there to Mr. Tirarira, Swa Ididindarira, Jazz Signal. They're partnering up with Roots Africa in a very important message. And Gezai Maoko, Regai Saungana, and COVID-19, Chiripo. Shout out there to Mr. Tirarira. To watch the full music, to watch the full video, and of course, see more of his work, visit his digital pages, of course. Also link across ukuthi Roots Africa la ikhona, visit their pages. Now muri Zimbabwe wonke umuntu ongena kuhlelo siyakwamukela kuhlelo namhlanje siqhubeka phambili sikhangela okwenziwa ngabantu abasakhulayo inhlelo zabo ezijonge ukuthuthukisa uZulu nxa sisikhangela indaba zempilakahle. Here we're focusing on healthcare programs that have been set up by Zimbabwean youth that are helping Zimbabwe in its fight against the COVID-19 pandemic. Earlier on, Saxoxa Lo Babu Sinyoni, who is the founder, Mkhokheli wenhlanganiso yeSila Health. Next up, we're going to be heading over to a conversation that we have with our medical expert. He's a friend of the show. He's been on the show a couple of times. Dr. Tinothanda Memeza. He's the president of Vaccine Global. Now, to hear more about the work of Vaccine Global and, of course, how Vaccine Global is contributing towards Zimbabwe's fight against the COVID-19 pandemic, I reached out to Dr. Tinothanda Memeza. We had a conversation via telephone. So let's head over to that conversation. Nyora in my comments, in comment section, kuchono maondring, pamsoro pezwe chirongwa chatina, nasi mchongwa. Ngatinze, urukuru, yendagaita na Dr. Tinothanda Memeza.
Right. So Vaccine Global is a global health security company. So we're a digital health verification company, and we verify health documents and health records. And in particular, at this present moment, we verify COVID-19 test certificates and also vaccination.
All right. Well, Dr. Memeza, once again, thank you so much. As usual, we really appreciate having you on the show. You always bring such amazing knowledge that helps not just us in terms of the discussion, but our listeners, they really value. So now let's delve into it. The last time we had you guys on the show, focusing on Vaccine Global, I had the entire board. And the main topic of discussion at the time was how border crossing was contributing towards Zimbabwe's COVID-19 cases, because a lot of people are crossing borders using fake COVID-19 certificates. Now, is that pandemic still ongoing in Zimbabwe?
So, well, there are cases here and there, but we have tried to mitigate that challenge through our Vaccine Global system, whereby when a lab tests a certain person for COVID-19, when they generate the result is then tied to the patient's information through biometrics and also through digital QR code. So this QR code readily found on the certificate, such that when the person is traveling or at the border or is flying, the QR code can be easily scanned through our Vaccine Global system. Can be verified to their name, and also where the test was done, and whether the test is authentic or not. So we've tried to contribute this to do this service in Zimbabwe through various labs, including one of the largest labs in Zimbabwe, Lancet Lab, that is using our QR code system, so that the people who are traveling and also the people who have been tested and the people who require to verify this information, governments like universities can be best assured that the test is actually legit and authentic and verified.
Now, let's talk a little more about the functionalities of Vaccine Global, what you guys do as a company on a day-to-day basis. Could you kindly tell our audience a little more about that? Like, what exactly is there to Vaccine Global? Tell them a little more about Vaccine Global as a company.
All right, so we work in conjunction with laboratories that are permitted to do COVID-19. Laboratories that have been given grants by the government and the Ministry of Laboratory to do COVID-19 tests. And these labs that are doing standard tests. So what a person does, they go to the lab and gets a swab COVID-19, and their information is put on the lab information system and also on our Vaccine Global system. So when the results come out, whether they're positive or negative, a QR code is then generated from the Vaccine Global system that is then attached to the COVID-19 certificate to prove that the certificate is actually authentic. And that code can be easily verified in any port of entry, and also be it airports or the road port, whereby those who are verifying can easily scan the QR code and the person's information come up, say this person actually went to the lab, get the test done, and they didn't just print out a certificate that.
Now, there's some people who probably have used fake COVID-19 certificates, and they don't understand why people like yourselves are making a big fuss of it. So whilst we're on the discussion of fake COVID-19 certificates, could you kindly explain to our audience why that is such a bad thing and why it's so important that they use legitimate COVID-19 certificates, especially when it comes to things such as border crossing, et cetera, et cetera?
Well, it is dangerous, particularly if you are going to be mingling with people, particularly if you are going to be on the plane, which is a highly aerosolized system, sort of like a closed system. And imagine traveling a 20-hour flight and fake certificate probably have COVID-19 that hasn't been confirmed, but have it. So during that whole time that you're flying, you are actually spreading this condition that we say is a pandemic. And like imagine a plane of 100 people, you are in that flight for 20 hours and you easily spread that condition to 100 people that are from different nations and probably from different backgrounds. So the danger that is there in terms of spreading the disease and traveling with fake documentation is really, really serious, and it shouldn't be.
All right, Dr. Simemeza rekaini bokubata ipamuromo ipapo chimbozi yanyaya nerurimi rwamai kuitira kuti vanongotaura ushona vanyatsonzwisisa nyaya yatinayo nhasi muchirongwa. Totanga tichitarisa kanyaya yekambani yenyu yeVaccine Global. Ndachikumbira kuti mutsananguro kune vateereri zvizere nezvebasa ramunoita sesangano reVaccine Global.
Okay, sangano redu rinobetsera kuauthenticate matest anenge aitwa nemaresults anenge abuda kana munhu achinge atestwa for COVID-19. Izvi tinozviita tichishandisa digital method yemaQR code atinoisa pamacertificate anenge agadzirwa nemalab anotenderwa kutesta for COVID-19, such that saka barcode iri rinenge rakaatacha neinformation yako yemunhu anenge atesta, such that paunotravel paunoenda kwaunenge uchienda kunenge kuchiiwa COVID-19 test, vanenge vari guaranteed kuona kuti sure iyi test ndeyemazviro kwazvo, munhu yakatest wanikwa asina chirwere, saka test iyi iri authentic. Isusu seVaccine Global tinobetsera kuona kuti matest anenge aitwa ndeyemazviro kwazvo, vanhu havasi kufamba nemapepa ivo vasina kuitwa matest. Saka munhu paunoenda kulab yakatenderwa nehurumende yeZimbabwe kuti iite maCovid-19 test, information yako inotorwa yoiswa palab system, yoiswa also paVaccine Global, such that a QR code is generated that is then put on your certificate when your results have been processed and they're out. And then that QR code inobetsera kuti paunenge uchifamba ungave kukwira ndege, kukwira bhazi, kana kunge uri pane vanhu pakazara vanhu, test yaunenge waitwa iyoyo inenge iri authentic, iri easily traceable, kuti yaitwa kulab ripi, yaitwa kumanguvai uyezve yabuda nguvai, such that vanhu havafambe vane matest efake zvataiona zvichiita mazuva ekutanga.
Tichitarisa mashoko amakaparura pawebsite yenyu, pawebsite yesangano renyu reVaccine Global, ndakamboverengawo mashoko anoti kambani yenyu yakanyanya kunangana nekubatsira vadzidzi pasi rose kwete muzimbabwe chete. Ndanchikumbira kuti mutsananguriro vateereri zvizere kuti kambani yenyu iri kubatsira vadzidzi sei?
Saka chandinotanga kutaura ndechekuti isusu tinoshanda nemalab akatenderwa nehurumende kuti aite matest. Imwe tinokurudzira kuti vanhu vaende kunotestwa kumalab aya anotenderwa. Munokwanisa kumaona pawebsite yedu, Vaccine Global website. We have all the labs that are allowed to do COVID-19 tests for the purposes of traveling, kind of the purposes of social engagement. Ese aripo palist yedu. Aya zvinobetsera kuti kana ukatestwa mazviro kwazvo, result yacho inobuda iri yechokwadi, kana either iri positive kana iri negative. Kana iri positive, woita zvatinenge tichitaura mavhiki ese, self isolate for 10 days. After that, kana uri right, unokwanisa kufamba zvako usangana nevamwe. Asi kana iri negative, unotenderwa kuita zvaka uchingoita. Izvi zvinobetsera kuti tidzivirire vanhu chirwere ichi cheCovid-19 chatekeshera nyika yese pasi rose. Saka kuitira kuti ma-results edu anofanirwa ari chaiwo. Saka unofanira kuti uwane ma-services edu, ma-laboratory akatenderwa anova ariwo pawebsite yedu, such that ma-results anobuda avewo emazviro kwazvo, ibetsere kurwisa chirwere cheCovid-19.
Aiwa takunzwai zvakanaka Dr. Tinotenda Simemeza zilo kandaba kuhlelo silo Dr. Tinotenda Simemeza ingcwethi kwezempilakahle, nguye njalo okhokhela inhlanganiso yeVaccine Global. Sikhuluma nje le inhlanganiso isebenza gadalala bedlelana lohulumende kaMongameli Emmerson Mnangagwa, besebenza ndawonye logatsha olukhangela ngezempilakahle, iMinistry of Health and Child Care, kwezokuthuthukisa eleZimbabwe kwezempilakahle, ikakhulukazi kulesi sikhathi eleZimbabwe lilokhe lilwisana ngaleli gciwane le-coronavirus. So Dr. Simemeza, back to you. As we wrap up, I'm sure that people were really curious in terms of where they can access more information of Vaccine Global, and of course, where they can find more of your services. So do kindly tell our audience how they can get a hold of you guys as Vaccine Global.
All right, so you can find us on our website, vaccineglobal.org, or you can say vaccineglobal.com. It will come out, and you can always communicate us through our website. We are also on all social medias. Twitter, our handle is @VaccCGlobal. Instagram is also @VaccCGlobal, and Facebook. And you can even get in touch with us on LinkedIn @via.
Well, thank you so much there to Dr. Tinotenda Simemeza, friend of the show, medical expert, the president of Vaccine Global. Ubechasisa ngempela okunengi ngenhlelo zabo njengenhlanganiso njengenkampani iVaccine Global, and of course are focusing on how bona njengenkampani are helping Zimbabwe better face umkhuhlane lo we-coronavirus. But now, whilst on the discussion of COVID-19, there's a lot of people to this day who still don't understand to what extent COVID-19 can affect people, and of course, why all these media publications and why government itself is making such a big fuss around the spreading of coronavirus, and of course, the whole idea of social distancing, mask, and so much more. Recently, a US-based organization named the Southern African Community USA, popularly known as SACU, had a town hall whereby a young Zimbabwean who contracted coronavirus spoke more about to what extent COVID-19 affected him. And of course, he urges Zimbabweans to continue observing the COVID-19 protocols, so gezani izandla, practice social distancing, and of course, ligqoke ama-mask zvisinei nekuti namba dzevanhu vari kubatwa necoronavirus munyika iri kudzika. Let's hear more from Greg Jaricha, a young Zimbabwean based here in the DMV, and of course, to watch the full town hall that was hosted by the Southern African Community USA. They were focusing on COVID-19, focusing on the vaccine, and focusing on lockdown. Feel free to visit their Facebook page. Let's take a look at what Greg had to say.
So in January, on January 3rd of this year, I was tested positive for COVID. Those are probably the most painful 2 weeks of my life so far, because that entailed me coughing And when you're coughing, you're literally choking. You feel like you're actually drowning or suffocating. In my experience, I was home coughing, I was choking, I was sitting in bed, literally not able to breathe. And it felt like also, you have a really terrible cold because your nose is congested and breathing is impossible through your nose. And anytime you try to lay back or anything, especially at night, that's when really apparently you develop all the mucus that slides back into your throat, so it makes you cough again. And you literally have a constant headache the whole time. That lasted for a good, literally 10 days. I had no taste. And in those 2 weeks, the only thing that really worked well for me was when I was, in my language, say kunatira. Kunatira is when you take a blanket, you boil some herbs, and you cover yourself and just to steam it out. And so when things were at their worst, that's what I relied on to breathe. But the unique thing about me is that soon after that, I was cleared end of January the 23rd, saying, oh, you're corona free, tested negative, praises and everything. I was singing, rejoicing, thinking, hey, now I'm clear. Now, since Corona started, I've been considered an essential worker. So I work in marketing, but the company that I work for produces and sells vitamins and supplements. So obviously, I was taking vitamin C. I had access to all the best supplements out there. And so clear lungs, all these products just to clear out your system of all the virus, tried it all. So that helped. I was cleared, went back to work. And surprise, surprise, beginning of this month, unfortunately, I tested positive again when I went in for a regular checkup with my doctor. And so that's because the whole time I was coughing, I was still having this cough that never really went away since, Corona happened.
Well, Muria Zimbabwe, you heard there from Greg Jaricha, a young Zimbabwean based here in the DMV. Lapha kwele Melika ubechasisa ngempela his ordeal as he, of course, encountered the COVID-19 pandemic, explaining as to why it's so important to observe all these COVID-19 preventative protocols. But now, whilst on the discussion of the works of Zimbabweans who are all helping in their different manners, in Zimbabwe's fight against the COVID-19 pandemic. Let us head over to a report that was recently done by VOA correspondent Columbus Mavunga about the works of an artist who's using his craft towards educating Zimbabweans on what should be done to prevent oneself from contracting the COVID-19 pandemic. Let us hear more from the report done by Columbus Mavunga.
The 40-year-old Zimbabwean sculptor David Ngwerumo now has what he calls COVID-19 gallery. His exhibit called Arms encourages people to take the COVID-19 jab to help the country reach its vaccination target of 60% by the end of the year. Another one called We Are Torn encourages people to sneeze into their elbows. And the most talked one encourages people to mask up in an exhibit called MJ, named after the late US pop icon Michael Jackson, known for wearing masks and gloves.
Now, I'm using his figure around this COVID pandemic on my art to show that Michael Jackson gave us a warning that mask up. And his figure shows a finger pointing out to us as a people, saying, mask up.
Ngwerume has posted his pieces online to keep people from coming to his studio and potentially spreading the coronavirus. Art dealer Shingirai Mafara says he wants to hold an art exhibition to display Ngwerume's work for a wider reach.
So I find these pieces very, very pivotal in terms of not just putting back Zimbabwean art sculpture on the map, because we're definitely back on the map, but also setting awareness to the entire world. Let's get vaccinated. Let's wear masks. Let's social distance. Let's hold hands and try to get through this together.
Ngwerume's work has also caught the attention of officials in Zimbabwe. Artists like him, the country's art council representative says, are thinking outside the box.
The situation has taught our artists to be resilient, taught them to be imaginative and to be creative in terms of sustenance and how do you make a livelihood in such an environment which is not easy to operate when sources of income, creating money or making money has been closed totally.
Ngwerume hopes to work with art auctioneers and use part of the proceeds to get personal protective equipment or PPEs for Zimbabwe's health workers. Zimbabwe's doctors and nurses have struggled due to lack of adequate resources while working in the front lines of prevention and treatment during the coronavirus pandemic. Columbus Mavunga for VOA News, Harare, Zimbabwe.
Well, muri eZimbabwe umthakazo omuhle lisanda ukuzwa okunengi inhlelo ezikhokhelwa ngabantu abasakhulayo. There you just saw i-report eyenziwe intatheli izindaba i-correspondent yomsakazo we-Voice of America uColumbus Mavunga ubexoxa lo mnumzana uDavid Ngwerume, an artist based in Zimbabwe. Umsebenzi wakhe ngempela as an artist, as a sculptor, ngumuntu osebenzisa ama-sculpts akhe ukuthi afundise abantu okuthile ngokumemetheka kwe-coronavirus elizweni, ebatshela okuningi ukuthi hayi izulu kanti bakumele liqhubekele phambili ligqoka ama-mask, lingaminyani njalo ligeze izandla. Sakandiwo kamabasa ari kuitwa nevechidiki muri yeZimbabwe manzwa report yaitwa nemutapi wenhau weVoice of America vaColumbus Mavunga, apa vangachikurukura navaDavid Ngwerume nezvebasa ravo ravari kuita mukubatsira Zimbabwe mukurwisana nedenda re-COVID-19. So zulukandaba uhlelo lwethu labasakhulayo wonke umuntu osanda ukungena kuhlelo. Everybody that's joining us right now, welcome, welcome, welcome. If you tuned in right now, you're tuned into Livetalk, the connection. I go by the name of Mike Hove. Namhla zulukandaba siqhubeka sihlaziya okwenzakalayo elizweni okumayelana ngokumemetheka kwe-coronavirus elizweni. Sixoxa ngabatsha ngenhlelo zabo ezisiza eleZimbabwe ekulwisaneni ngomkhuhlane we-coronavirus. Lingakhohlwa izulukandaba ukuthi lilakho ukubhala imibono yenu kukhasi lethu le-VOA Ndebele, and we're going to be reading those comments live on air. Chirongwa the connection muineni Mike Hove muri yeZimbabwe munhu wese akupinda muchirongwa pari zvino tinotenda zvikurusa. Unfortunately tino urombo chirongwa chedu chatiri kukupa inhasi hachisi live. This is a pre-recorded program. Zvisinei muri yeZimbabwe sematauriro edu, we are broadcasting live pamapage edu matatu paFacebook, paVOA Shona, VOA Ndebele pamwe chete nepaVOA Studio 7. Tiripo zvakare paYouTube. Our official page is a VOA Zimbabwe. Saka musakanganwe muri yeZimbabwe kutinya pai pakanzi share kuitira kuti tione chirongwa chedu chevechidiki neuwandu hwedu, uyezve musakanganwe kunyora macomments mucomment section kuitira kuti tizive kuti zvechokwadi vangava nesu nhasi pachirongwa chedu chevechidiki ndivanani. Tinotenda zvikurusa munhu wese ari kupinda muchirongwa pari zvino muri yeZimbabwe. Wonke umuntu engenayo kuhlelo siyakwamula kuhlelo okhulumayo nguMike Hove. If you tuned in right now muri yeZimbabwe, you tuned into Live Talk. I go by the name of Mike Hove.
Zikhipha lapho egama nguMawiza, I'm a choir artist aka Mr. Ngikhuluma isikhiwa ngevernacular. Guys, COVID-19 abayibiza ngecorona into ekhona. Phambili nge-social distancing, asigezeni izandla always, stay safe, stay home. Last number.
Easy, easy, easy machita, easy, easy, easy.
Easy. Easy machita, easy. A shout out to Mr. Ngikhuluma isikhiwa ngevernacular Mawiza. There for that amazing message. Just like Jasik now uyalikhuthaza uMawiza uthi hayi zulukandaba geza imawoko gezani izandla. COVID-19 is a real uyasho ngempela uMawiza ukuthi it's there. Lingakhohlwa check him out on social media at Mawiza Online. That is on Twitter and of course on Instagram. Ukhona njalo kuFacebook. Now, muri yeZimbabwe, as we reach the end of tonight's program, I want to use this opportunity to celebrate the lives of young Zimbabweans who are working really hard to represent Zimbabwe on the international stages. Tonight, muri yeZimbabwe, we're going to be speaking to several different youth. Of course, earlier on, we've highlighted the works of Babu Sinyoni, we've highlighted the works of Dr. Tinotenda Simemeza. All of these guys are working on a global scale. But I want to continue celebrating the lives of Zimbabwean youth. This time, we're not just focusing on COVID-19. We're focusing on different young people who have done different things towards putting Zimbabwe on the international scale. Now, this person I'd like to start off by celebrating is Kelvin the late Kelvin Lokshin Obama, as many know him. Some know him as Vin. Now, Kelvin passed away last year in October, but Calvin's work and the memory of Calvin lives forever in the hearts of many, not just people in Bulawayo, but a lot of hip-hop fans, a lot of urban music fans. I remember the works of Calvin. Now, as we commemorate the year of since his passing, I found it important we use our platform to celebrate the works of Calvin. Now, let us take a look at a clip that we prepared, whereby we were remembering the life of the late Calvin Mhliziyo.
I don't know, but I think it's Calvin on the beat.
On Saturday, 24 October 2020, 35-year-old multi-award-winning rapper Calvin passed away, an event that left a lot of Zimbabwean creatives mourning the loss of a legend, Intwana Eluveve, Intwana Kamanax, names he was affectionately known by. The 35-year-old, who has been described by some musicians as a torchbearer, passed away with over 10 official albums and 20 underground projects to his name, which featured hit singles such as Ubulawayo, Skipani, which featured multi-award-winning artists Casper Nyovest, King Kong, and more.
One, two, three, go! When they see me, they're like King Kong. On my chest, I'm like King Kong.
To hear more about the legacy Calvin left behind, I reached out to some creatives who have either crossed paths with Calvin, had a chance to work with him, or knew him very well. Afro jazz musician MJ Sings says Calvin helped him break into the industry.
So it's early 2014 and I'm performing my first ever gig and I'm doing a cover song. And here comes this guy. He's got merchandise, he's got caps, backpacks, everything that you can imagine. I'm like, who's this guy? And he steps on stage and he just blows the crowd. So when he steps out of the stage, he comes to me and he says, "Kid, you're a star. Please come to my studio next week." And that's how it started, man. We recorded my first single, did everything from artwork, promo work. That's how it all started, man. And we just started creating music.
Well, Muria Zimbabwe, there you're hearing about the memory. We're celebrating the late Calvin Mhliziyo, aka Lokshin Obama, aka Vin. He was known by several different names. May his soul continue to rest in peace. And of course, may his work resonate through the hearts of many across the whole country, across the whole continent, across the whole globe. Now, speaking of the lives of people that were touched by the late Calvin Mhliziyo, earlier on, you briefly heard from MJ Sings, Afro soul musician. Now, MJ Sings talks about how Calvin gives him his big break. And of course, since his big break, MJ Sings has been unstoppable. He's worked with the likes of people from Kalawa Jasmine Music, the record label Speedy from Kalawa Jasmine Music. He's worked with multi-award-winning producers such as Murphy Cubic. Recently, MJ Sings caught up with him to talk about his latest single titled Feels, where he worked with award-winning producer Murphy Cubic. Asizweni okunengi MJ Sings esichasisela ngale ngoma yakhe entsha. Let's head over to the conversation that I have with MJ Sings.
The weird story is that it's actually the last song that we recorded on the EP.
Okay.
So it's just basically a story about a couple were in a relationship and they started together when things were really like on the low, on the ground. Then as soon as things started moving for the other party in the relationship, one of the spouses no longer doing, the things that he or she was doing in the relationship in terms of consistency and being around.
I know you've been very busy. You've been on several different endeavors. You've been writing, producing. Before you even put out Fields, I saw you were doing something for Speedy with those guys with Kalawa. What's that been like, man? What's that journey been like? And how is it helping towards this project?
Man, that journey came as a surprise. Because I really didn't think that at some point in my career I'll be writing for like such legendary artists, because man, I've been listening to Speedy's music since like yeah, exactly. So it's been a life-changing experience, and it's really connected me with different creatives and people that are really playing really big parts, like in terms of the music industry.
Under like lockdown and all that, like a lot of artists were very crammed down. You guys weren't gigging. You guys went, like a lot of you were kicking it. Like, how did you find that period?
At first, we complained about the whole thing, but then we sat down and we're like, guys, let's make the most out of this. So we started putting out as much content as we can in terms of just trying to flood the market with our music and all that. So we actually saw the positive side of this whole pandemic instead of just looking at the negative side. We noticed that a lot of people are online and active right now. So we started just reaching out to everyone, because there's no way Speedy was going to respond if it was like during normal time.
Touring and right.
But the pandemic helped us to connect with all these guys.
Take it back to the project itself. What can people expect? I know, like I said, the single Feels for me is a great vibe. You and Murphy Cubic always produce amazing stuff together. What can we expect more from the project?
Expect something different. I know people were now used to the old chill vibes, but this time I tried to just explore and challenge myself in terms of creating new vibes and just tapping into different sounds and all that.
So let's wrap up our conversation here, MJ. Tell the people where they can find this project or they can find the single. And
so for this single, we just decided to put it on YouTube because our intentions were not to monetize with this one, but we're definitely gonna we've uploaded it actually on online stores. So yeah, that's what's up, man.
I'm gonna ask you to do things as we wrap up. Into yokuqala is phoselama zokugcina to abalaleli. Number 2, abantu they want to hear you sing ingoma yangikhona awubashaye nge-freestyle.
Hayi zathi khaf fast. Ngithanda ukubonga nje ngesupport eselinginike yona lokungixhasa nokungiphusha. Nje it's because of isupport yenu lothando lwenu, and siyabonga kakhulu. Angihambi ngiyedwa, ngihamba labanye bami bakhona lapho khonapha nje wathi ngibabongele lapho. Then isesondeza lapho ku-autotune. Hayi, autotune asisebenzisi.
Usebenzisa natural voice.
Bazothola abahlali bayo, sewundizela phezulu namhla sawungazi. Bazothola abahlali bayo, how sewundizela phezulu namhla sawungazi. How manje sewuyabanda, hey, how manje sewuyabanda. Yiyo le.
Vele kumele bahambe ku-YouTube. Hambani ku-YouTube Zulukandaba. Make sure you go stream it on YouTube. MJ, thank you so much for taking time out to be with us. For bonga thina. Unfortunately, my time is up. Yes, Studio 7. My time is up. At Big Mike 3 on Twitter and Instagram is my username for those looking to catch up with me. Otherwise, Muria Zimbabwe, let's meet same time, same place. Yes, Studio 7 next week. I know when I Mike Hove, Ikamang Mike Hove, Togazo Zimbabwe. Bye-bye!